I'm Rebecca Pryde and I'm a clinical psychologist and the clinical lead in Shore Psychology. And today I'm going to be telling you about the autism assessment process at Shore Psychology. We understand that deciding to pursue an autism assessment for yourself or for your child can be a big step, and not knowing what to expect can be anxiety provoking. So we wanted to make the process a little bit clearer. So the first step is deciding whether an autism assessment is right for you or your child. So we offer an initial screening appointment where we'll meet with you, and if it's for your child, we'll meet with you both. And all of the clinicians who carry out our autism assessments have received specialist training to do so, and all of our assessments meet NICE guidelines, which means they're evidence-based and best practice. So during that initial screening appointment, we'll find out information about some of the experiences in daily life, for example at school or work, relationships and at home. And we'll find out how many difficulties you or your child might be experiencing. We'll ask questions about communication and social interaction experiences, sensory differences, and any interests. We'll also look at strengths and any area of difficulties and get a history of those experiences too. And if the appointment is for your child, we'll speak to you beforehand about how best to do the appointment. So it might be that your child stays for the full appointment, or it might be that we spend some time with you by yourself. We'll always work with you to do what's best for your child. And based on that initial screening appointment, we'll then decide whether there's enough evidence to go ahead with the full diagnostic assessment. And if that is the case, what we'll start with is arranging another appointment where we'll gather lots of in-depth information about childhood. If the assessment is for your child, we'll just meet with you for that appointment. And if the assessment is for you as an adult, you can bring someone along who knows you well and who might be able to help you answer some of those questions about your early years. And the sorts of things we might ask are about socialising, about communication, interests, behaviour in those early years. And we'll also get you to fill in some questionnaires that gives us really useful information about any traits of autism you or your child may have. And part of the diagnostic assessment also usually includes a structured diagnostic assessment called the Autism Diagnostic Observation Schedule, sometimes also shortened to the ADOS. And this is considered the gold standard in autism assessment. And it's assessment which is based on play and conversation, which provides information relating to strengths and difficulties in communication, social skills, play skills, and looking at any repetitive or restricted behaviours. The ADOS alone shouldn't be used to make a diagnosis, and it's always used alongside all those other observations and information that we've gathered during the full assessment. And for autism assessments for children, it's also really important for us to get information from your child's school. So with your consent, we get another clinician who hasn't met your child to observe them in the school environment. And this can give us really valuable information about how they are in school. And we'll also speak to your child's teacher and get them to fill in some questionnaires too. So once we've gathered all the assessment information we need, our clinical team will meet together to look at all that assessment information and make a decision about whether we feel that you or your child meets the diagnostic criteria for autism. And then we will meet with you and your child to feed back this diagnosis. And we'll talk to you about the outcome of the assessment, but we'll also look at all the strengths that you have as well as any recommendations that we can make that will support you for anything that you find difficult. And if the assessment is for your child, we'll also feed back to your school and talk and work with them to think through any recommendations that we can provide to best help your child at school.